They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking about everything thyroid health related. Our guest today is Horizon Health's Dr. Edward Rico. Welcome back to the show.
Oh, thank you, Lacey.
Of course. So last time Dr. Rico talked a little bit about thyroid, a lot about just the endocrine system in general. So you covered a wide variety of things. And I wanted to dial in a little more on the thyroid. So first off, for folks who don't know, what does the thyroid do?
Well, the thyroid produces thyroid hormone, which is really kind of a master metabolic regulator of the body. Nearly every tissue in the body has receptors for thyroid hormone. Heart, lungs, bone, muscle, as well as the central nervous system. So virtually every tissue in the body is affected by thyroid hormone disruptions, either deficiency or excess.
And it's one of those conditions that you're going to notice if your thyroid is either overworking or underworking.
Yes, that's definitely the case. Textbooks describe thyroid hormone as having a narrow therapeutic index, which is really just a long-winded way of saying if your levels are too low or too high that you won't feel well.
Definitely. And so there are two, at least from my knowledge, two kind of ways that the thyroid can swing. It can either be hyperthyroidism or hypothyroidism. Can you talk about both?
Sure. Hypothyroidism or underactive thyroid hormone deficiency, far more common. The vast majority of patients with hypothyroidism is related to an autoimmune condition called Hashimoto's thyroiditis, again, named after a Japanese physician who first described this about 100 years ago. Mm-hmm. People with Hashimoto's thyroiditis, for reasons that we don't fully understand, but we know are much more common in women than in men, an autoimmune reaction develops antibodies against proteins normally found inside the thyroid, resulting in an influx of antibodies as well as white blood cells. The net effect of that process is that it reduces the efficiency of the thyroid with regard to producing thyroid hormone. So ultimately those patients will develop diminished thyroid hormone levels and the classic constellation of symptoms being cold and tired, fatigued.
And then on the flip side of that, what's hyperthyroidism?
Hyperthyroidism is an elevated level of thyroid hormone in circulation, has kind of the opposite effect of hypothyroidism. Instead of feeling kind of cold and tired and sluggish, patients with hyperthyroidism often feel kind of sped up, rapid heartbeat, skip beats, heat intolerance. Patients often feel like someone who's had too much coffee.
Mm-hmm. Just got that kind of the jitter, just feel like you're going. And so is this typically something that you see in younger people, older people? When do people normally get diagnosed with it?
Well, thyroid conditions can manifest at any age.
Okay.
In fact, newborn infants are screened for thyroid disruption at birth. But there's no hard and fast rule when patients may develop thyroid dysfunction, either overactive or underactive thyroid.
And so if we're still kind of studying it, there's no way to really pinpoint like what triggers a change in your thyroid's activities?
We don't know with these autoimmune conditions. We do know that, for example, Hashimoto's thyroiditis, which is responsible for hypothyroidism, is much more common in women than it is in men. About 8 times as many women have Hashimoto's as men. And we presume that's because the immune system is much different in women than it is in men. And that has to be true, otherwise pregnancy would not be possible.
Mm-hmm. And so people with hypothyroidism, do they have to have Hashimoto's, or can you have one without the other?
Well, the presence of the autoimmune reaction typically precedes the development of underactive thyroid. There are a handful of patients that will be antibody positive for Hashimoto's that never develop biochemical hypothyroidism, even though the vast majority of them will. There's other causes of hypothyroidism, most commonly with patients that have had thyroid surgery, patients that have had a previous history of overactive thyroid with something like Graves' disease or toxic multinodular goiter that's also responsible for hyperthyroidism. If those patients have definitive treatment for those conditions, they can develop hypothyroidism as a result of the treatment.
So how do you know if you've got either the Graves' condition or the goiter? Is that what you said?
Yeah, with regard to hyperthyroidism, the most common cause of that is something called Graves' disease, which the name sounds terrible, but it's actually after Dr. Graves, who was an Irish physician who first described this in the 19th century. Patients with Graves' disease, again, is an autoimmune condition. These patients develop antibodies that, instead of interfering with thyroid hormone production, it stimulates increased levels of thyroid hormone production inappropriately.
So is this something that can be hereditary at all? Is it ever noticed that parents have it and then children have it, or?
Well, there's not a distinct gene that's been identified that raises risk level for development of autoimmune thyroid disease, although clearly it does tend to run in families.
Interesting. So how do people typically find out that they have a thyroid condition? I know you mentioned that people can be sluggish. I know in my case, I found out through a blood test that was done.
Yes, most people will find out with routine screening. I think it's reasonable as part of an annual, comprehensive physical exam to have screening for thyroid conditions. Of course, every adult that I know is fatigued, so.
Yeah.
But most people will find out as a result of lab testing.
And so for folks who may be new to this, what are doctors kind of looking for in those lab tests? Is there, I mean, I know what I'm kind of asking, the TSH and the T4, how do they how do people navigate those numbers, I guess?
Okay. Well, TSH, which is short for thyroid stimulating hormone, is produced by the pituitary gland in response to circulating thyroid hormone levels. So we all have a very nice negative feedback regulation system by which the way it's supposed to work, if thyroid levels are too low, then TSH is increased, which stimulates the thyroid to produce more thyroid hormone. The reverse is true as well. If thyroid levels are too high, then that tends to suppress TSH from the pituitary gland, which allows thyroid levels to become lower.
And so the numbers that it's supposed to be at, is that a one size fits all, or what's a typical healthy number?
Well, most physicians were taught in training that TSH is the most sensitive indicator of thyroid levels, which is true, but there's many circumstances under which the circulating free thyroid hormone levels won't correlate well with the pituitary TSH response. But in general, we think that as TSH goes up, thyroid levels will go down, and as TSH goes down, then thyroid levels goes up. We think of, even though the lab reference range for TSH is fairly wide, we generally think that a patient with normal thyroid function will exist with a TSH within a fairly narrow range, about 0.3 to maybe 3. And again, patients that have a TSH that's higher than 3, we think of them as being associated with underactive thyroid or inadequate replacement. And patients with a TSH lower than 0.3, typically they're either overactive or they're on too much thyroid hormone.
So is this something that my primary care doctor can handle, or at what point do I switch from primary care to a specialist?
Well, the vast majority of patients with thyroid issues, certainly hypothyroidism, are managed very capably by primary care. There are certain situations that are a little bit different. Most patients with hyperthyroidism will probably be managed more effectively by endocrinology. Certain conditions for thyroid disruption for moms during pregnancy, those patients should be managed by endocrinology because we see more of them.
And so is there any lifestyle changes that can be made to help your thyroid perform better?
Well, patients are always asking, since it's an autoimmune condition, shouldn't we be doing something to manipulate the immune response? And ideally that would be the case, but we're not yet smart enough in the 21st century to be able to do that. So in short, management of thyroid dysfunction, whether it's hypothyroidism or hyperthyroidism, is kind of focused on medical management with either replacement of thyroid hormone in patients with hypothyroidism or with medical management to slow down production of thyroid hormone in patients who are hyperthyroid.
So if somebody is put on a replacement hormone, a thyroid medicine, is that something that they have to then do for life?
Well, as a practical matter, the autoimmune condition is progressive. Most patients will find that their own native thyroid hormone production over time will continue to diminish until the thyroid is not producing any thyroid hormone anymore. So the short answer is that the vast majority of patients, if they're started on thyroid hormone replacement, they'll be on it for the duration of their life.
And so I think you bring up a good point that it might not be the same dose for your whole life. Is that correct?
Correct, right. Right, thyroid hormone requirements are affected by several things, but predominantly by the patient's height and weight. So a larger person requires more thyroid hormone than a smaller person.
And so as you're finding, I guess, the right dose, can patients kind of still feel those symptoms, or how does that process kind of work?
Right, patients who are not on enough thyroid hormone will still feel cold and tired, at least until their replacement dose is adequate. But we do follow them fairly closely with lab testing, and we're always reminding patients how important it is the way in which they take thyroid hormone. Thyroid hormone is notoriously affected by impaired gastric absorption, so other medications or food can bind up and interfere with the ability to absorb thyroid hormone. So every time we call a patient from our office with lab results, we're always reminding them of the same thing, to be careful to take the thyroid hormone on an empty stomach with water only, and to keep it away from food or other medications by an hour is preferred.
Does it matter whether you take it in the morning or at night?
Well, the half-life of thyroid hormone is quite long. For T4, which is the main thyroid hormone, the half-life is approximately 7 to 8 days, so levels don't change very quickly. There's no discernible peak, with taking the thyroid hormone at one point in the day versus another. So there is flexibility with administration times. For most patients, it's easier for them to be, on an empty stomach when they wake up in the morning. Although we have plenty of patients that we advise that it's okay if they get up at 3 a.m. to use the bathroom, they can take the thyroid hormone at that time, and that way they don't have to wait to eat when they get up several hours later.
And let's say I was rushing out the door of a morning and I forgot to take it. Does that impact me at all, or how does that work?
Well, from one day to the next, not really that much, although it's better to keep stable levels to take it on a regular basis.
So what is maybe the biggest lifestyle change that you see once people start actually getting to take the correct thyroid hormone and their thyroid and everything else is kind of falling into line?
Well, again, we've stressed a lot about, the proper administration with water only on an empty stomach. There's some medications that are exceptionally well known for interfering with thyroid hormone, like calcium, iron, fiber. Proton pump inhibitors are classically associated with impairing absorption of thyroid hormone, but literally any food or medication can interfere with effective absorption.
I guess what I mean is, like, after people start taking the thyroid medicine, what kind of lifestyle change do they notice? Are they, when they're feeling better, is it like a night and day kind of thing? What have you noticed in your practice over the years?
Many people will notice issues like fatigue and energy levels. A common input that we get from patients. They will describe mental acuity, sharpness, memory. Patients will come in and describe kind of this brain fog that permeates their day. And when the replacement is optimized, they often will comment that they feel so much better than before they were on replacement.
And when people start taking replacement, do they ever notice any sort of side effects?
The main side effects are going to be with either inadequate replacement or excessive replacement.
So if it's excessive, would it be like if I was experiencing hypo and kind of feeling sluggish, but then I've got too much and I start feeling the hyper kind of jittery, or?
Yes, exactly. That goes back to this narrow therapeutic index of the thyroid hormone.
So what do you notice is the biggest question that you get in your office when somebody's first diagnosed with a thyroid condition?
Well, patients will often come in and ask about, the role of generic thyroid hormone formulations versus brand names, and I understand everyone is being pressed for, cost concerns with medications and healthcare, and some patients will do very well with generic levothyroxine, but some patients really don't. There's quite a big variation in what the U.S. Food and Drug Administration will call therapeutically equivalent. You can have 100 micrograms of generic levothyroxine, brand A, B, or C, and the effect on the patient can vary quite a bit and still be considered therapeutically equivalent. That's the main benefit of a patient being on a brand name thyroid hormone, because they'll get exactly the same thing every time.
So if you're a physician who is looking at somebody's thyroid, are there ever any abnormalities that you can just see, like physically the thyroid looks different, that might be a cause for concern?
Sure. The thyroid is right out in front. It's kind of right behind where the knot in my thigh lives. One thing that's interesting is that a person can have an enlarged thyroid, and that can be associated with underactive hypothyroidism, or it can be associated with elevated or hyperthyroidism. So increase in size of the thyroid is something that many people will notice. Sometimes a patient will notice it themselves, when they're getting ready for the morning, looking in the mirror, or they have other friends or family members who point out enlargement of their thyroid.
And I think last time you were on, you were kind of talking about thyroid nodules. Are those cause for concern?
Sure. Thyroid nodules are very common. We think that at least half the public older than age 60 in the U.S. has thyroid nodules. The vast majority of them are benign and don't create much in the way of problems, but there is a small percentage of thyroid nodules that have the start of thyroid carcinoma, which is why we pay attention to them.
And how do you typically catch or diagnose thyroid cancer? Because I feel like that's not exactly a part of the body that is always scanned as much as like for breast cancer or things of that nature.
Correct. There are no current clinical practice guidelines to screen patients for thyroid cancer, but I think it's very reasonable for primary care to, again, as part of their annual follow-up and comprehensive physical exam, to do a quick thyroid, direct neck examination as well.
So at what point would you maybe have to consider having your thyroid removed? What would cause that?
Well, again, thyroid nodules are very common, and the vast majority of them don't create much in the way of problems. The American Thyroid Association and other bodies in endocrinology have noted that for patients that have thyroid nodules that are larger than 1.5 to 2 centimeters in size, or that have certain concerning radiographic characteristics on ultrasound, those should be evaluated with what's called a fine needle aspiration biopsy to assess for the risk of malignancy.
And so if I'm somebody who has to have my thyroid removed, what does recovery and life after that look like?
The vast majority of patients following thyroid surgery, whether it's half the thyroid that's removed or the entire thyroid that's removed, do very well. I mean, these patients have a lifelong requirement for thyroid hormone replacement, and they sometimes note challenges with calcium stability, because the parathyroid glands are located behind the thyroid and they can be easily affected by surgical intervention. But the vast majority of patients do very well as long as they're on appropriate replacement.
And if I'm somebody who's been put on thyroid medicine and have a thyroid condition, are there other maybe vitamins or supplements that can help with conditions like the fatigue if maybe I'm at a good dose of my thyroid medicine, but I'm tired still, or absorbing these vitamins like you said, that's so important?
Well, this is where regular follow-up is incredibly important, for patients that are on thyroid replacement. We touched on a little bit earlier that the vast majority of patients on thyroid hormone replacement will be managed very effectively by primary care. The vast majority of primary care physicians really focus on monitoring TSH. Again, there's conditions under which the TSH is not an accurate reflection of the patient's circulating thyroid hormone status. So we see a fair number of patients that they may be on an adequate amount of thyroid hormone, but if they're not absorbing it consistently, then there'll be a discordance in their values. Their TSH won't correlate well with their free thyroid levels.
So is that where, again, we just keep the tummy empty when we take it? Is there anything that can help with absorption, or am I just kind of up a creek?
Patients that have absorption difficulties will do better with one of the name brand formulations, and there's some of the newer ones that are especially effective in patients that have difficulty with absorption, patients that have sensitivity to gluten or to starch or coloring dye. So there's not all thyroid hormone replacement formulations are created equally.
Fair enough. So if I have a thyroid condition, I know you've mentioned Hashimoto's, I know you've mentioned Graves' disease. Are there any other types of conditions that kind of go hand in hand with thyroid conditions?
Well, again, we touched on a little bit earlier about how important thyroid hormone is during pregnancy. The requirement for thyroid hormone goes up substantially for moms during pregnancy, typically anywhere from 30 to 50%. A mom with a normally functioning thyroid can just produce more thyroid hormone, but moms that have a thyroid condition can't always do that, so they have to be monitored and adjusted appropriately to maintain adequate levels during pregnancy.
So after they give birth, do their thyroid levels go back to normal?
Typically they will resort to a lower level similar to what they were prior to pregnancy.
So if I have just given birth, will my thyroid still, will it bounce back after I've had a child as well?
Well, that response varies. I mean, there are some moms that will have normal thyroid function during pregnancy, and then they would develop the autoimmune reaction that creates hypothyroidism following delivery. So lots of changes in the immune system in relationship to pregnancy, both at the start of pregnancy and then following delivery.
Seems like there needs to be a lot more research on this if it's really impacting these ladies and not having a whole lot of, answers. What are you typically seeing in your office? Maybe the most interesting case you've seen in your time there?
Well, there's a number of patients that come in that have been, managed a little bit suboptimally. Again, if the previous physician had only focused on TSH levels, we actually see patients that are on, excessive replacement, and that's not something that comes to light unless the free levels have been checked. So as a result, I never check less than TSH in a free T4 level.
And in our last minute or so here, is there anything else I didn't ask about that you'd like to share with our viewers, or anything that might be helpful for the folks at home?
Well, just that thyroid conditions are very common, and because of the influence on multiple organ systems in the body, patients that have thyroid levels that are too high or too low just will never feel well. And I think there's that can be difficult to determine in adults because, again, most adults that I know work too hard and don't get enough sleep, and they're often used to the idea that they don't feel 100% all the time. But patients that require replacement, for example, they just will never feel right if they're not replaced adequately.
So it's almost kind of like a bit of a sneaky disease that it can just creep right in, and you just think this is how life is going to be.
Well, many things that we deal with are a little bit like that, much different than having a broken leg or a bad appendix. Those things kind of reach out and grab your attention, and these things are a little bit more subtle.
Well, thank you, Dr. Rico, for coming on our show. Very informative. I appreciate your time.
Okay, thank you for the invitation, Lacey.
Of course. And thank you for joining us for this episode of Being Well. We hope you'll join us next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.